Would you like to add to that?
If we build it, they must come. That's the critical issue facing local leaders who are deciding not if we need a new hospital, but where it will be located. Representing the administration at an oversight hearing on the feasibility of Ypao Point was acting CLTC Director John Birch, a late substitute for the recently retired Alice Tyron. He says members of the previous 36th legislature already seemed to rule out that location as too small, as senators and the governor unanimously decided that Guam should build a state-of-the-art medical campus to house all healthcare agencies.
The healthcare center would position Guam as the regional healthcare hub of Micronesia, fostering opportunities for medical training, tourism, and enhanced medical professional services throughout the entire region. Aside from the pandemic, which further underscored the need for improved healthcare facilities, there are no apparent reasons to deviate from the initial intent of the 36th Guam legislature.
But Dr. Jonathan Thorpe of the SDA Clinic says Guam doesn't need such a massive medical campus. The new hospital, he says, could easily be built at Ypao Point, and the current location could continue to house behavioral health and more.
We have a good facility there. There's room for expansion there. Why do we need to expand it out? The adjacent nature of the behavioral health to either the Ypao Point or the existing facility is not too far to transport a patient. On that point, I would make the point that you have the existing Guam Memorial Hospital facility that would not necessarily need to be completely condemned, but would work very well for a public health facility and a CDC operated lab. So again, why are we spending limited dollars that eventually have to come out of our pockets as taxpayers to build this massive campus where we're replicating and duplicating buildings and structures that we already have in point?
Also supporting Ypao Point was Dr. Thomas Shea. 90% of current medical clinics are within 10 minutes of Tamuning, and Shea says that proximity to the hospital saves lives. He quotes the administration's own report by consultant Matrix, which he says favors Ypao Point by a wide margin.
Look at 0 to 10 minutes. You got almost 36,000 population of patients that have direct access within 10 minutes. If you have a heart attack, you're in labor, you're bleeding, trauma, you're going to need access. You got 36,000 in that population there. Now, even when you go 20 minutes, Ypao Point is still higher. Next slide. When you look at this next one, this is talking about Adalca, which is what Guadalupe is focusing on. And they're saying we're going to build this out there because it's better for patient access. No, it's not, according to that $6 million study. Read it. 10 minutes. It's only 13,000 people that's accessible at 8% of the population.
With the pros and cons of Ypao Point now laid out, another hearing is scheduled for November 1st, this one on the governor's choice of Crown land in Barrigada. Nestor Lecanto, KUAM News.